Hello guys, welcome back once again to Meta YouTube channel, and I'm meeting you for quite some frequent time these days. And I have with me Dr. Anjali, and Dr. Anjali has scored a rank of 315 in this NEET PG 2025. First of all, congrats, Anjali. So we had a brief
Thank you.
discussion before this. Most welcome, Anjali. So Anjali was, I asked, like generally the question which I ask is, how do you feel, happy or relaxed? Anjali's term was neutral. So let's start from there. So, how was your journey, Anjali? Reading for NEET PG, how was it? Just a introduction about yourself.
Hello, myself Anjali Mishra. I got All India rank of 315. I am from Government Medical College, Badayu, UP, and this was my first attempt in NEET PG. The journey was a bit a roller coaster, I will say, because it's not a smooth path. It's all up and down, and I just waited for this day, not for exactly this day or something that will satisfy my that I have achieved something. Or from very beginning I just dreamt of some central institute or aims or something like that. But after getting NEET to 315 all India rank, I'm not I can't conclude myself that I am happy or I'm good or I'm neutral. I just
It'll take some time, Anjali. And like you said, your aim is November NST, and I hope you will crack that as well in flying colors. So, Anjali, like one thing which I asked Anjali before the interview, and she's said an answer which I liked a lot, which is like, I have one special skill, that is studying, and I'm going to give everything to that. And she's been a university topper. She's been a good student all along. So, Anjali, one question from Adya and other person as well. So, from when did you want to start preparing for NEET PG focused or an competitive exam focus, INACT or NEET PG?
so actually the journey has started a bit earlier because being I was student in a GMC Badayu and we were the first batch of that college. So we have no seniors. Actually, we don't have any guidance for NEET PG examination. So I knew that for getting a good result, I have to start earlier. So my main NEET PG directed preparation was started in my final year examination, after in my final year and the internship.
So, if
So
you are the first batch means you have lots of juniors who will be looking up for you. And I
yes,
think
sir. Yes, sir.
you might be very famous in your college right now. So, first of all, congrats for that. And I hope you guide more juniors into the path. So, let's take like this NEET PG exam. Like, was it similar to a GT what you have given, or was it difficult, or was it easy? What was your perspective?
Sir, this year the NEET PG examination was really was on a difficulty level from easy to moderate, not very easy or not very difficult. The questions were easy to moderate level, and the main thing was the options were tricky because there were two options. For example, every question was like a familiar question, or not a new question or something like that they have asked something new or some out of the box. But the options were very tricky. That for example, there was one MRI image. Then you have to see or you have to analyze whether it is adenomyosis or intramural fibroid.
Mm-hmm.
So many questions were like that. So the main thing was कि you have a in-depth knowledge or the ability to rule out the options. For example, from four options, you can easily rule out the two options. But the main trick or the main game in between those two options which has been left. So if you are able to choose the correct option, then whole game lies on only those two options.
Perfect.
And I have just figured out this कि if you want to excel in this type of examination, whether it is INICT or NEET examination, the syllabus is same, the almost the level is same. There is no such difference, only the few subject preferences in both INICT or NEET examination. The whole game lies in the MCQ solving skills only and only. it doesn't depend how much you have read your theories, how much you have read this app, that app, this coaching institute, that coaching. It doesn't matter. If you have one resource and you have done it properly and you have applied that knowledge into the MCQ solving skills, then it will be 100 and 200% fulfill your it doesn't matter ki from where you have done your theory part, because almost every teacher is good in their field. For example, sir, I just love the way you teaches your pathology, your statement ki, for example, if you have, if you haven't seen any for example a new question on HEN, the pathology slide, then you can something figure out by looking the nucleus, by looking the cells, whether it is inflammatory slide or acute inflammation or chronic inflammation. Well, something you can figure out if you have the real concepts.
So great. So it's about overall understanding of the medicine as a whole, not like subject wise. The goal is to
Yes.
treat the patient. So obviously, every MCQ scenario based MCQ is going to be like the same, right? So, is there any favorite subjects for you? Like among the 19, like I like this more. Obviously, you said you're going to take general medicine. So let's keep general medicine away. In the rest of the 18, do you have any favorite subjects?
Sir, my anatomy was very good.
That's great.
My almost in this NEET examination, I think, or in INICT may also, I got all the anatomy questions right, because I had heard many students that they are feared of this anatomy subject, but I liked anatomy and pathology especially,
Great.
because I think these are scoring subjects. If you know, then you know. There is nothing in middle.
Great. So was there any difficult subject from your perspective? Okay, this was something which is difficult for me.
Sir, I think PSM.
PSM. Okay, so since you said PSM is a difficult subject, I want to know for your juniors as well, how do you tackle a difficult subject? Because that also is a very scoring subject as well. Quite a
Yes,
few
sir.
come from PSM. How did you tackle that?
Sir, in my perspective, for these difficult subjects, first your first aim should be your previous year questions. For example, if I know that I am weak or not good in that particular subject, then I will first of all focus the previous year questions, so that my 50, 60, or 7 up to 70% things will be cleared, or because the topics are repeated and that's a rule. It's, for example, if you are getting 10 questions, then up to 7 to 8 questions will be repeated from your previous year topics. So if I am clear about that previous year topics, then obviously I will score up to 70-80% in even my weak subjects also, and that's a good strategy according to me.
So rather than reading the entire thing, focus on the target, go with the PYTs, and then maybe complete the backend, right? So
Yes.
actually, you said previously, like you have always wanted this place or dreamt of this place where you can give your guidance to your juniors. So
Yes, yes.
the floor is yours, the day is yours. So what do you want to tell to your juniors who, like, every batch in your college, right from the first year till the intern is going to look up for you, and also many, many more in the country, right? So what do you want to tell them? Unfiltered, okay, this is what you have to do. What is that?
Guys, देखो, नीट एग्जामिनेशन और आईएनआईसीटी एग्जामिनेशन कोई अंतर नहीं है. देयर इज नो डिफरेंस इन सच. थोड़ी सी स्ट्रैटेजी में थोड़ा सा स्ट्रैटेजी में डिफरेंस है बस. और बाकी the whole game lies in the MCQ solving skill, and the MCQ solving is a skill. You have to develop it, and it will develop day by day, not overnight. And even a topper or even a rank one holder, he will also suggest, uh, if you converse, अगर आप उनसे बात करोगे तो you will realize कि the whole game lies in MCQ solving skill. गलत होंगे questions, the questions will be wrong in your practice time, but you have to do it again and again, again and again, on day by day. The score will rise. You will see your improvement. And the main game is accuracy. Work on your accuracy. For example, if you are doing 10, if you are doing 8 out of 10 questions, then your accuracy should be 85 to 90%. Means if you are attempting 8 questions, then almost 7 questions should be correct. Not तुक्का मारना और ये सब चीजें नहीं. Your accuracy should be the main aim the main target is to maintain or to increase your accuracy up to 80 to 85%. For example, in NEET examination, 200 questions, if you are attempting 190 questions, 195, then your accuracy should be maximum. There's less negative marks, so that your rank should be higher, or your score should be आपका स्कोर अच्छा है और इन चीज़ों से और and the main and one most important thing is GTs देना exam your habit to give a GT to sit for 3 hours for continuously 3.5 hours, and this played a very important role in especially in my journey, because I used to give GTs regularly, because and I had give every type of GT, whether it is easy, moderates, very difficult, everything, because I just thought कि एग्जाम तो कैसा भी आ सकता है, it can be very easy or it can be very difficult, so that I doesn't have any fear. I just create my environment like that only, sitting for 3.5 hours and give the examination, so that I can acclimatize myself for the NEET examination or whether any type of examination.
Great, great. So Aditya has commented. Aditya has keep on asking you questions. Like, Kamanta, like, what's your GT frequency?
So every week.
Every week. That's great. That's great. So great, Anjali. It was nice talking to you, and it's refreshing to see younger people aiming for INICT, even in spite of getting good rank. You said that you will write for November INST, and I hope that you get into AIMS Delhi, your seat of choice medicine. Final few words. Do you want to thank anyone? Obviously, the first thing, obviously, is going to be parents and their support. Anyone apart from parents and support who has played a important role, like in your 5 years of your MBBS and your internship. Is there anyone you want to thank?
Sir, first of all, especially you have already mentioned, I want to thank my parents, because this journey is not an easy journey, because every in few days there will be emotional or mentally burnouts. In those days, your family, your friends will play a major role for from coming out from those days and getting back to your routine normal. And especially, sir, the teachers, for example, sir, you, Rishabh sir, they all have been played a very major role in, especially I think every candidate in the journey of every candidate. And for your motivation, I have remembered, before my NEET examination, you all have conducted the NEET PG previous year videos. I have seen that those videos, because on those time I was not able to focus with myself. So I just opened my laptop and just passively saw your videos, मतलब every subject. So they were literally very conceptual. उससे मतलब I was able to learn even when I was not able to study.
Perfect, perfect. Thank you, Anjali. So there's one last question. With that, don't want to take much of your time. You have to go and enjoy with your parents, and also start your INICT prep as well. What was your GT marks? If you are okay to share, Vinay has asked a question like any one GT marks
Sir, uh,
or the correct answer. If you don't know, remember the mark, how many corrects you got during GT?
sir, I think approx 160 plus 160 to 164. And in this NEET examination, I think I got 168 or 169 correct.
That's an amazing thing, Anjali. So all the very best once again to crack INICT November and to go to your dream college with general medicine. And I hope any super specialist in your mind or just general medicine.
Sir, cardiologist.
Cardiologist, great. I hope the country will have an amazing cardiologist in the future, and that that will be that's with us, right? Thanks a lot, Anjali. Thank you for your time, and thank
Thank
you
you
for
so much,
giving
sir.
valuable advice
Thank
to.
you.
Thank you. Bye bye.